How does the BEAR help the ACL to heal? Well, the knee is a watery environment. And when you go in and you put stitches in and you try and get that ligament to heal back together, one of the problems is that there's a lot of fluid in the knee that's sloshing around. Now, the thing that the body needs to heal tissues together is blood, right? And the trouble is that the blood clot that forms around that ligament starts to wash away because of the fluid in the knee, because of the aqueous environment, or the watery environment of the knee tends to wash away the clot. And that's where the BEAR comes in, and that's where Martha Murray's extensive research came in that developed the BEAR, the whole thought process. She was focusing on trying to get those mid-substance tears to heal, to hold the clot in place. And the solution that she developed and studied extensively was the BEAR implant, which is a collagen sponge that, and collagen, by the way, is kind of what we're made of, right? So it's not a sponge, but it's a collagen sponge. And what we do is we put that inside the knee, and that soaks up the blood and holds it in place around the ACL.